Greetings from Bangladesh to the Honorable Chair and to distinguished audience. I'll be highlighting our experience in Bangladesh, especially the challenges. So you see, Bangladesh is a country, small country in size maybe, but we are large in population, 160 million people. If we calculate from the crude birth rate and approximate live births, and considering that 1/5 of the live births is preterm, it comes down to a whopping more than 400,000 premature births every year. And when we consider the magnitude of ROP, we are the 7th highest in the country, India being the highest one and China number 2. Since 1990s, NICUs were being established in Bangladesh, but the first paper came out of Bangladesh was in 2004. But as you know, recently we have become a middle-income country. NICUs are being set up in divisional headquarters. UNICEF and the government of Bangladesh has planned to set up NICUs in 64 centers. But where do we stand regarding ROP screening and treatment? These are the only few centers that you can get ROP screening and treatment. What it means is that most of the NICUs and SCANUs are not under ROP treatment or screening facilities. The first 4 are the main apex institutes. The first one is the only university where I work, NIO being the largest government institute, and the other 2, 3rd and 4th, are private centers. The other ones are private centers where we basically work. So it's the same people, morning and night. And very recently, only outside Dhaka, Mymensingh BNSB has started doing ROP. So if you plot all the centers, the main centers doing ROP, they are formed within several kilometers to each other. The first paper that came out of Bangladesh was this one, and it showed about 4.4% children having ROP. The second one was in 2008, which showed 11.11%. This is the disease profile from the 4 different centers up to 2018, the total number of the main centers, almost 4,000, 3,953. And if we see the ROP percentages and APROP percentages, these ROP percentages in the teens and APROP percentages in the 5 or 6, so the total would become somewhere from 19 to 23. So we, in one of our papers, it came to as 23.7%. And then after that, that was in 2017. And this last year, there was another one that actually calculated between very low birth weight and extreme low birth weight babies, and the ROP were more or less similar, 23.5%. If you consider very low birth weight, which was below 1500, that's 20.83. But in case of extreme low birth weight babies, you see 44.44%. This is from last year. And in the same study, you see the APROP in the extreme low birth case are 37%. So APROP, obviously, as we know, tends to be more in very extreme low birth weight babies. So the challenges, as you can easily understand, extremely inadequate service. Mostly Dhaka-based centers, very few centers. Even in Dhaka, the smaller NICUs are out of the screening network. And for a country of 160 million people, where there are 1,200 ophthalmologists and 60 retina specialists, 40 pediatric ophthalmologists, these are approximate numbers. We are not considering the fellows. So less than 20 of us are actually doing ROP. Even or not all the retina specialists are doing ROP. Very few pediatric ophthalmologists are doing ROP, and very few ophthalmologists are screening. There is no mid-level ophthalmic personnel, no optometrists, nobody is helping us, and there is no source of formal training for ROP screening. All of us who are doing ROP in Bangladesh have been trained somewhere in India. I've trained in LVPI under Subhadra Jalali. So lack of awareness is a big point, there was a CAP study which was conducted by my center, my university, Orbis International, and London School of Hygiene and Tropical Medicine in 2015, where we considered 10 NICUs, and we have found that even doctors have very little practical idea. Nurses had very few idea except NICUs. So awareness is very little. As you can understand, there's no national survey, very inadequate research. So how are we overcoming the challenges? Decentralization. Recently, we have gone out of Dhaka, in Mymensingh, in K. Zaman BNSB hospital, where in 1 year they have screened 1,142. So decentralization needs to happen. All this activity actually started in 2014 with the visit of Professor Rajvardhan Azad, and then there was Padmaja and Tapas sir with Subhadra Jalali madam who went there. There was a 7-day training and national symposium which led to this publication. It was a short communication situation analysis which also supports the findings that decentralization needs to be there and the crisis is very imminent. So we are working, just 1 minute, just a few seconds more. So we are working to raise the awareness to our level best, and these are actually the only people who are doing ROP in Bangladesh, our country with 160 million people. But one good news is that we have recently been able to get it into the Integrated Childhood Disease Management Protocol. We are almost there with Pediatric Eye Care Protocol, but we haven't been able to get it in National Eye Care Protocol, but we are working on it. So it's going to be very overwhelming with this inadequate manpower infrastructure. So we need to give special emphasis on ROP screening and treatment in Bangladesh. Thank you very much.
Thank you, ma'am. Very well summed up. Dr. Manish Tandon is there. Dr. Manish Tandon will be talking on when and how to manage babies diagnosed as AP-ROP and type 1 ROP. Any questions for madam? Very nicely summed up. It's a very rewarding thing to treat ROP. You know, lot of awareness and lot of surgeons to